with public health science, it's based on decades of evidence. So we know what we're talking about when we say tobacco causes 8 million deaths a year, alcohol, at least 2.6 million, unhealthy diets, 11 million, air pollution, 7 million, and even things like road safety. We can actually prevent a lot of deaths in this area if we put in the proper policies. So that's what Vital Strategies is about. We focus on the drivers, the determinants of health, some of which are listed here, rather than providing healthcare, health services, and health response. So we in the health sector have long recognized that the climate crisis is a health crisis. And we also urge all of you to use health as an entry point when talking to stakeholders, governments, communities, whoever it might be, because I think at the end of the day, everyone is very concerned about health. Health is wealth. Without health, we won't even be here. We won't be functioning well. And the climate can affect our health in actually two ways. One is the direct impacts, which is what most people think about, but also the indirect impacts. So I've listed here some of the direct impact examples, which include heat-related deaths, which are responsible for at least 500,000 deaths a year, air pollution, 7 million deaths a year, vector-borne diseases like dengue. I have a stat here. There has been a 12-fold increase in dengue from 2014 to 2024. So many new areas around the world are now experiencing what Singaporeans have been experiencing for quite a while. Of course, there's an increase in waterborne diseases from increased floods, typhoons, rainfall. There's, of course, direct injury and death from extreme weather. Mental health, certainly eco-anxiety is a form of mental health. And we can think about mental health as a direct as well as an indirect impact from climate change. And as the previous speaker mentioned, allergies as well. In some countries, the pollen season is getting longer, it's getting more intense, which can be really difficult if you're an allergic person. And in terms of the indirect impacts, of course, it impacts food production and distribution. I have another doom and gloom stat here, which is that the higher frequency of heat waves and droughts in 2021 compared to 1981 to 2010 is associated with 127 million more people experiencing moderate or severe food insecurity. Clean water and sanitation, rising sea levels, floods, droughts even can harm a lot of water supplies. Natural habitats and ecosystems. I'm not sure if any of you are familiar with the One Health approach that links humans with the environment, with the climate, as well as with animals, both wild and domesticated. And I think a good example of how this is relevant to our health is in COVID-19, which is thought to originate from the bats in China. And in fact, another stat here, about 60% of emerging infectious diseases originate in animals, both wild and domestic. And as we know, climate change has a huge impact on the natural habitat. Internal displacement, this one may or may not surprise you, but in 2022, climate-related hazards displaced 32 million people globally, which is an increase in 41% compared to 2008. And 70% of these internal displacements occurred in Asia Pacific. And as you can imagine, internal displacement is a huge mental health strain on anyone, as well as physical health. And then, as the previous speaker mentioned, damaged infrastructure, disruption of communication and other essential services, which may not seem that important if you're in good health, but if you're someone who's disabled or you need access to frequent healthcare, this can really impact your health outcomes. So, as I think many speakers will mention, the climate crisis is not a fair crisis. The people most impacted are those that are the poorest, the most disenfranchised, the marginalized groups, the vulnerable populations, the very old, the very young, the indigenous, the disabled, the infirmed. Okay, I'm going to skip the doom and gloom stats. I'm going to jump into Singapore. Now, the good news is that Singapore actually has a very strong public health and infrastructure system. So we are incredibly lucky. And we can see this from the way that the government has managed the dengue epidemic as well as COVID-19. But still, we're not immune to definitely the impact of climate change on health. And I'm going to focus on two particular hazards here. One is on heat, and the other is air pollution, which I view are the two most impactful hazards on Singaporeans. So, in 2024, which, as some speakers have mentioned, it was the hottest year on record. And Singapore had an extra 122 days of extra dangerous heat days. And other than heat-related illnesses, actually, heat has a lot of impact. It lowers our productivity. It reduces our concentration. If you notice that you have more road rage, you're angrier when the temperature is hot, that's not a myth. That's actually based in science. They found that there's increased aggression, increased domestic violence and crime when temperatures go up. And vulnerable individuals need more attention and support. And by vulnerable, usually we mean young children, especially babies and infants, which may not have the right means to vocalize how uncomfortable they're feeling. And even pets can experience heat stress. You know, dogs and cats, they don't have the ability to sweat the way that humans have. So pay very careful attention to vulnerable individuals and your pets as well during the hot days. I also wanted to add that even though we have a very strong public health system in Singapore and we can rely on our government for a lot of things, an effective heat response actually requires interventions or solutions at all levels. So, not just at the national level, but even at the institutional level. For instance, if you run a company, if you run a childcare center, what are the measures that you can put in place to reduce the impact of heat on the people in your company? For instance, I know that my son, during the heat waves, you know, he suddenly could rip off his shirt and wear a tank top every day. And he was very happy about that. He could bring his handheld fan into the classroom, things like that. But these are really low-hanging, easy solutions that we can implement right away without anyone needing to tell us what's needed. And even at the household level, if you are the master of the household, how can you make your environment more comfortable? How can you watch when you're going on an outing? What are the cooling devices you can bring? How can you avoid the hottest time of the days? And so forth. The last one I just wanted to add, I'm not sure if they are around, but Singapore has a Heat Resilience Performance Center, which is a research center based in NUS. And we are also the host of the Southeast Asian Global Heat Health Information Network. I just pulled this out from the Channel News Asia. So this is an example of a public health advisory that our government puts out. And it's really important to pay attention to these advisories that the government puts out because they tell you what to look out for. And in this case, this is giving you what the symptoms, what are the signs that you're suffering from heat stress, whether it's dehydration, heat exhaustion, or heat stroke. I threw this in because I think, you know, one of the consequences of climate change is that sometimes the weather might not be that easy for us to go out and do our physical activities, our exercises. And exercising is really one of the best things that you can do for your health. But how many times have you looked out and you'll be like, oh, I booked the tennis court, but now there's a heavy storm, so I have to cancel my booking. Or it's just too hot to go out for a run. So the question I have here for Singaporeans or Singapore government or whoever is that have we equipped our infrastructure in a way that we can still enjoy a lot of activities without being too weather dependent? Okay, so I'll end off with air pollution. And air pollution really is one of the key programs that our organization runs. And air pollution, normally people think of it impacting our respiratory system, but many people do not know that air pollution has a wide range of impacts on almost all parts of the body. And young children are particularly vulnerable. So I have this infographic of this young girl here. And you can see that the air pollution affects not just her lungs and ENT, but her growth, her skin, her heart. And what many people may not know is that air pollution is also linked to brain development in children. It leads to lower IQ, ADHD, anxiety, brain development, autism. So air pollution is a really important issue that we need to resolve. So this is my final slide. Basically, I wanted to share that when I talk about air pollution, many of you might be like, what pollution? Singapore has like blue skies. And how many of you actually think that Singapore has air pollution? Fantastic. I feel great because I'm in the right group here. So all of you are on board that even though Singapore is relatively clean compared to many Southeast Asian nations, we we're still not there yet. There's still some way to go. And one instrumental study, the Harvard Six Cities study, I'm not sure if any of you have read it, but I encourage you to Google about it because it was a very formative, groundbreaking study done 30 years ago that showed that measured air quality in 6 cities in the US and showed very consistently that when the air is cleaner, people live longer. And masks and filters, they're not really that effective, unless you can wear them 24/7 a day and you can make sure that there's no hole in your mask and your filters are working 100% perfect. They don't really work. Actually, the research has not shown that they have made much of a difference to health. Singapore's air quality levels are currently 2 to 3 times above the WHO standard for clean air. So yes, we have room to improve. Every improvement will save a life. That said, I do want to add the caveat that our WHO standard is quite stringent, such that today 99% of the world is breathing unclean air. Yeah, I'll be around during the networking session if anyone likes to speak to me. Thanks so much.